So let's talk about some of the other options you've got available for a sore throat from your pharmacy. Now we have sore throat gargles. Now betadine is an iodine-based one. What you do is you measure out the 15 mils in a pre-measured cup in there, gargle it at the back of the throat. Now if you can't gargle, these products aren't really any good for your sore throat because you've got to be gargling to actually get it to hit the back, to hit the sore spot in the throat. Now it's an antiviral plus an antibacterial. Now your Diflam C, it is an antiseptic plus an anti-inflammatory. So we see it used a lot for tonsillitis, laryngitis, mouth ulcers. Sometimes dentists recommend it post-surgery of any description to reduce inflammation and pain in the mouth as well. It can be used more like a mouthwash as well as a gargle to help kill things off. Then we've got the sprays. Now I really like the sprays. They have obviously nozzles inside them. The nozzles are there to spray it more directly to the back of the throat so you can pump directly to the sore spot. Now people who have a naturally large gag reflex probably find these ones a little bit harder to use. Possibly with a little bit of practice or a mirror, you can actually get the right spot with causing less gagging and more pain relief. Now these guys just have anti-inflammatories in them, so reduce inflammation and pain. Strepsils has 2 antibacterials plus a local anesthetic to actually numb the area. Now these guys aren't going to cure tonsillitis or any bacterial infection that may be there. It's just making it harder for bacteria to necessarily grow and or reducing inflammation in the area. If you have tonsillitis, again, it's worth seeing a doctor for some antibiotics potentially if they believe that's what you're needing to help get on top of it. But again, a couple of days use, and if it hasn't got any better, it's worth seeing a doctor for something stronger. So when I have a sore throat, I really like these throat sprays. What you do is you flick up the nozzle and you spray directly on the sore spots at the back of the throat. Now if you haven't used them before, I'd suggest using a mirror the first few times and get your aim right. They work near instantly, so they have a great advantage if you wake up in the middle of the night, you can spray the back of the throat and go back to sleep rather than sitting around sucking on the lozenge.